I support the process of people accessing community by making sure that there's community readiness, and with that, making sure that medical professionals are supported. I view this as an invitation for medical professionals, dental professionals, and people in the public to work together and really make sure that everyone that is accessing care has that opportunity to feel they are taking ownership of their own health. I don't think that dental practice and people that are in that realm intentionally leave out people with disabilities, but I do think that that has been happening. And I think that from my understanding, people haven't been empowered to take care of their own mouths and haven't been empowered to take ownership of their health in general. So I think that it hasn't been going very well in terms of people feeling empowered, but I think that there's an opportunity just to take time to listen and move forward from that. It's really important to educate people and give that experience to people. If you've never met someone with a disability, that's okay. But we can introduce you, and we can make sure that you have that experience so that when somebody comes into your office, you might feel a bit more comfortable. And really, I think that most people will find during this process is that it's not scary. People with disabilities are just like the rest of us. And actually, I think we all have disabilities. I know that it's kind of just a discussion point that we usually use in our presentations is that there's emotional disabilities, there's physical, intellectual disabilities, but when you focus on that part, then you can't really move beyond that. You only see the disability. I think it's important to remember not to label people, not to just see that disability, but to move past that and look at them as a person. And that might dictate how they interact with medical professionals forever. So you have the power to make that a negative experience, yes, but you also have the power to make that a positive one. And if you can engage with people, if you can take that moment and make sure that they feel comfortable, that they feel safe in your care, that can make all the world of a difference for them. It's so wide-ranging, the kind of care that people expect and feel they deserve. So if you ask a question, maybe not related to their autism, for example, it's not important that they have autism, but how does that impact them? So by asking, in the environment, is the lighting okay? Are you feeling comfortable in this room? And explaining the process. I'm going to be putting my hands here, just so that people know what to expect and they're not taken off guard. I think that in the past, we've been really comfortable with the notion that people with disabilities weren't really accessing care with the rest of us, and that is no longer. I think that absolutely we're ready. We just have to maybe tweak our practice a little bit to make sure that people feel comfortable. I think people with disabilities should be accessing care alongside anyone in the general public. It's not them who has to change. They don't have to go to anywhere special. But I think that we can make modifications to make sure that they are receiving proper care with the rest of the population. I think people with disabilities deserve the same amount of respect as anyone. I have the privilege to work with people who are very motivated. They're givers, they create community, they speak on their own behalf, and people are developing these skills everywhere across Saskatchewan. I think that what now we have to do is not just create those skills with people that have disabilities, but also with professionals, and to support everyone in that process. We're not pointing fingers, we're not saying that people have been treated poorly and condemning the practice. I think it's important that we just learn how to move forward and make sure that everyone feels like they can contribute to the process. I think it's important that we pay attention to the contribution that self-advocates are making to our community. I think Sean and Diane, their way that they shared their experiences and shared themselves, I think that's such an important thing that everyone should listen to. We want to make sure that people feel empowered and that they know that there is a standard of care and best practice that we expect. We want to invite people into that.
I'm feeling kind of nervous.
You always get nervous, but remember, deep breathing will really help you. Can you do that? Good.
Hello, Mrs. Criddle. It says on Sean's chart that he hasn't been to a dentist for quite some time.
No, he doesn't live with us anymore. He gets nervous going to the dentist, and his group home support people thought it'd be best if I brought him here.
It says on Sean's chart that he has a cavity in his back right molar, but I can't work on someone like your son.
Someone like my son, I don't understand. What do you mean?
Well, he has a disability, and I'm not equipped to work on him. I can refer you on to someone who is, but it will be a long wait. Their office will be in touch. Do you have any more questions?
No, I have no question.
Okay, have a good day.
Well, that really didn't help me feel more comfortable about being at the dentist.
Well, next time we know you can do better because you can speak up for yourself.
Why can't people talk to me like I'm a person? I'm sitting right here.
I know, Sean.
Yes, I felt I would have a better outcome if I felt that the professionals were more open to me asking questions and providing answers for them. I wish people knew about me that I am a person, and yes, I may have a disability, but you can talk to me just like you can talk to any other person. I understand what you're saying. Don't assume I can't understand. Medical professionals carry a responsibility to the general population, but particularly to people with diverse abilities, to help them, I guess, preserve their greatest sense of self and independence. Yes, just because of past experiences of not being spoken to directly and like, I guess, a typical person, for lack of better wording, and having experienced that in the past, that's always a fear that people are going to not see me as a typical person and not treat me as one just because I have the diverse abilities, and so they just see what's wrong, what the diagnosis versus the person. For me, being turned away at the dentist was not very good experience because it actually has made me scared to try going to a dentist again. And just because I'm scared they're all going to say the exact same thing of, no, you can't come without like your mom because of you have diverse abilities, disabilities, whichever you choose to word it, and that you're not cognitive enough to understand. They don't see that, and that really hurts. For that, just because I'm the kind of person who likes to kind of have things explained step by step kind of thing, just so I'm more comfortable with what's going on. Just trying to get me in, get me out kind of thing, which I didn't like at all. Speaking directly to future professionals, I want them to know that don't assume someone can't make decisions for themselves unless it's, I guess, legally documented and you have that on your records. Then please assume that regardless of whether however the person communicates, they have some ability to make their own decisions. And if need be, whether there needs to be an interpreter for whatever reason, or someone there to verify information, just please talk to the patient directly, as that makes a big difference in our world.
When the dentist comes in, they seem kind of rushed, when they just look at your teeth and then they tell the assistant to what needs to be done and stuff, and they're gone like before I can like ask any questions or anything like that. I think it would make all the difference in the world if they just took the time to actually speak with the patient more on what's going on, what's happening, and be respectful about it. If they took the time to actually get to know you a little bit, maybe, and know and maybe them get some education on people with anxiety problems or disabilities or diverse abilities, that would help immensely with, I wish people knew that I'm just like they are. I get up in the morning and I go to bed at night just like everyone else. I may need to have things talked through a little more than others, but I think everyone deserves the respect, no matter what abilities or diverse abilities they have. Anyone really, I think they should be treated the same, anyone, like anywhere, no matter what abilities or disabilities. The thing that makes me most nervous about going to the dentist is not knowing what's going to be wrong with my mouth, I guess, like whether I'll need a fillings or something worse, like a root canal or having teeth pulled or something like that. Just something going wrong. The dentist office, it is hard to relax and stuff like that. As anybody has a hard time relaxing at the dentist office, but something I could probably share that I've found out over the years to help with anxiety anyway is controlling your breathing and just trying to mellow out and not think about it so much. Try and put it out of your head when it's happening and close your eyes if you have to.
I have 4 boys. 2 of my children have disabilities, so I came by it naturally, kind of naturally. Plus, I've worked in the field of disability for a long, long time. My one son had a lot of sensory issues, and he's like a lot of people. They don't want anybody going into their mouth, but it just has, a lot of anxiety for the mom and dad and whoever brings their brother, sister to their family member to the doctors. And I think communication is really important, and to do some homework beforehand to sort of explain to the dentist or doctor, whoever, that these are some of the triggers, rather than to have surprises, And another thing, if they approach them properly, it's approach, it's what is said and how much is said. And I think if they listen to the caregivers and the people that really know the children, I think it can eliminate a lot of stress, anxiety, and expense. Because, a lot of children that go under general anesthetic, I think is done unnecessarily sometimes. Appearance plus it can affect your heart and so many things, infections. And I think it's just, in the scheme of things, it's not prioritized. I think aesthetically is maybe not on the top of the list when it comes to some people that may have some challenges, other challenges, which I find very irritating, because we want everybody to be treated equally and have equity. And I do think that there's a perception that and a lot of individuals that I've met over the years, they've had a lot of extractions, which is very suspect, I find. Instead of doing the preventative measures, teeth are extracted unnecessarily. I don't think it's happening as much as it used to, but I'm just saying that seems to be the path of least restriction is taken. Parent, you kind of have it. You second guess whether there's a double standard, because you feel like I said that to a dentist. Well, if it was your kid, would you do this? So it's that, second guessing. And, if you have a child who's nonverbal or doesn't really communicate, usually they'll communicate through other ways, like behavior. I don't like the word behavior, but behavior is communication. So I think that would be a way of understanding. And when you have an audience, you act different sometimes. When you're just on your own trying to deal with something. It depends on the personality. Support networks and building support around an individual rather than working in isolation. So that dentist or that doctor is just one person in that person's support network. So they should really rely on the other people that really know the individual to get really valuable information. Even if there was some sort of questionnaire, like they have a lot of these profiles, and I mean not negative, but like the positive and the actually, like I said, the triggers or something that would really, like a light or something that would cause someone anxiety. So there's I've known about sensory issues and people on the spectrum, and you learn why certain things irritate yourself, because I think we all have some sort of disability. When you're at a meeting and someone is constantly looking at you, I find it really unnerving. Like, you think, why are you looking at me? You're dismissing everyone else, or you think I'm more important than you, than the rest of the people at the table? So that's exactly, I just go back to myself thinking this feels really uncomfortable. And it's a big onus to be having someone, and you're not sharing the information. So, and you know, when it's a person that may be thought of as not understanding or not absorbing or have the cognition to take home what the doctor or dentist is saying, then there's really a lot of sensitivity. So always, everyone else can hear in the room, so direct your conversation to the person that has the mouth that you're looking into.
I'm feeling kind of nervous.
Sean, I know, but remember, deep breathing always helps you. You can do that, right? Good.
Hello, Mrs. Criddle. It says on Sean's chart that he hasn't been to the dentist
Well, that's
for
because
quite
he
some
gets-
time.
Excuse me, why are you talking to my mom when I'm the one sitting in the chair? I haven't had a great experience at the dentist. I have a disability, but you can talk with me.
Oh, I'm sorry, Sean. I'm Dr. Dolan. It says in your chart that your back right molar has a cavity in it.
Hold up a second. I don't know what a molar is.
Oh, I'm sorry. One of your back teeth has a cavity in it, and it will need to be filled. We can book you in next week if you'd like.
Okay.
Some people feel anxious about the procedure. Our office offers techniques to help to calm people. Would that help you?
Yeah, I think it would help.
Okay, I'll make a note of that on your chart. And we can discuss some options on the day of your appointment.
Well, thank you. This is the first time I've ever felt comfortable at the dentist. Thank you for taking the time to talk this out with me.
You're welcome. I can understand why people feel nervous coming here. I try to make all my patients feel more comfortable. Do you have any other questions?
No, I think you covered it all. Thank you very much.
Okay, you're welcome.
Thank you, Dr. Dolan. Good job. You did a great job. You spoke up for yourself. That's fantastic.
Thanks, Mom. I feel much better after having all of this explained to me.
Good job.
I think the biggest thing is to treat people with respect. Treat everybody as an individual and make it a welcoming place so that it can be a positive experience for everyone. When someone with a disability is booking an appointment, to certainly take more time with asking questions, informing them of what is going to happen during the appointment, who they're going to see, more time for the appointment so that it's not so rushed, to be a little bit more flexible with the time that's taken for them. We tend to work on a 1 hour, very structured, rushed time period, and so oftentimes people need more time to be able to discuss, provide feedback, and for us to give information. Also, a good tip is to book appointments with patients with disabilities at a quieter time of the day in the practice. So perhaps first thing in the morning or at the end of the day when there's not so much going on in the practice. So during the phone conversation, if the person who's had it with them, if they could record the notes in the patient's chart, and also to have anyone that's going to be seeing that patient to have read the notes ahead of time so that they are prepared with some concerns or some questions that patient may have. And it's also a good idea to have the patient arrive 5 to 10 minutes early. When they do arrive, for someone to greet them, again with kindness and respect, to assist them if they need it, and to again explain who they're going to be seeing that day and what procedures they're going to be having done. Another great idea is to any forms or medical history documents that you're requiring the patient to fill out, if those could be sent ahead of time, mailed to the patient so that they have more time to complete them and then they can bring them at the time of appointment. I think we need to allow more time during the appointments to allow that open communication, for people to ask questions, for us to take adequate time to respond and instruct patients on what they should be doing and what they're going to be having done. I think we need to be open to using sedation dentistry as well, if that's an option for patients. To have more support staff in the office to support during the appointments and during treatment. To welcome support people that come with the patients with disabilities into the operatories for the treatment time if they so choose. Again, open communication on whether that's something that they desire would be a great thing. The importance of having the same oral health professionals see them each and every time is very important as well. They get used to building, they build a relationship with those particular people, and to see them each and every time provides some consistency for them, which is very, very helpful. And to also allow periods of rest while they're in the chair. People's mouths get very sore, and to have them open for an extended period of time is very difficult. Well, I think it's our professional responsibility to treat all patients, regardless of abilities or disabilities, as an individual, and to treat them with respect and provide individualized care. And we can't necessarily predetermine what that patient needs or what they're going to be like before they get there. So we need to assess that once they arrive, and to be able to, again, and treat people individually. We have the opportunity to engage with people to improve their quality of life and the care that they receive. For more information, please contact the Saskatchewan Association for Community Living at www.sacl.org.